Speaking on behalf of the Caribbean community as Health Spokesperson, St. Kitts and Nevis Prime Minister Dr. Terrance Drew reminded world leaders of their commitment to universal health coverage and the limited progress made so far. Prime Minister Drew was addressing the high-level meeting on universal health coverage themed Expanding Our Ambition for Health and Well-being in a Post-COVID World. While the COVID-19 pandemic affected progress on achieving goals for universal health coverage, PM Drew told leaders that getting control of the high level of non-communicable diseases globally was critical to instituting universal health coverage.
4 years ago, we committed to moving together to build a healthier world through universal health coverage. Sadly, at the current pace of progress, up to 1/3 of the world's population will remain underserved by 2030, and there has been minimal or no progress on service coverage since 2019, largely because of the COVID-19 pandemic. Mr. President, the governments of the Caribbean community remain fully committed to achieving universal healthcare coverage. We underscore that people everywhere should have access to nationally determined sets of promotive, preventive, curative, rehabilitative, and palliative essential health services across the life course, while ensuring that the use of these services does not expose them to financial hardship. We welcome the commitment to scale up efforts to build and strengthen quality, people-centered, sustainable, and resilient health system entirely through implementing people-centered, gender-responsive, disability-inclusive, and race-responsive health interventions. Our primary health care policies have been a cornerstone of our health care coverage implementation, delivering an estimated 90% of our essential interventions. We will continue to build upon our primary health care systems to broaden the scope of our coverage and will also strengthen our health workforce. Mr. President, non-communicable diseases account for 74% of all deaths worldwide, and universal health coverage cannot be fully realized until NCD prevention and control are addressed globally in a comprehensive manner. CARICOM, as a region with a high non-communicable disease burden, continues to prioritize primary and specialized health services for the prevention, screening, treatment, and control of NCDs, including factor reduction and risk factor reduction and prevention in its health policies. We will continue to champion this cause.
The meeting held during a forum of the 78th session of the United Nations General Assembly, where political leaders, policymakers, and experts in the field of healthcare discussed critical issues surrounding universal health coverage. Ben Bard reporting for SK Newsline.